Welcome to the Synergy Sessions, Aging Smarter in Silicon Valley. I'm your host, Tom Nelson, and I know firsthand as a family caregiver and part of the sandwich generation how tough it can be to take care of your aging parents while balancing your own life, career, and family. We'll bring you the experts and information necessary to help make your life a little bit easier and you a little bit smarter. Synergy Sessions is brought to you by Synergy Home Care, bringing you personalized in-home care and peace of mind to Silicon Valley families. I really do hope you enjoy the show. Hi, everybody. Welcome to the Synergy Sessions, Aging Smarter in Silicon Valley. Today, I am super excited to have Dr. Yumi Taylor from HottoCare with us. She is the CEO and founder of HottoCare. HottoCare is a Medicare Guide participant and provides comprehensive dementia care management and covered respite care for their unpaid caregivers. HottoCare is devoted to making the care of aging adults less onerous on the healthcare team and more beneficial to the patient and their family. And that is key. This is all about the caregivers and supporting the family. So happy to have you on. Thank you for being here, Dr. Taylor.
Yeah, thank you for having me, Tom. Excited to share more.
So let's just start with just tell a little bit about your background and HottoCare and maybe kind of high level on what HottoCare does to support families and caregivers with loved ones with dementia.
Yes, great. I'll start with HottoCare and then I'll jump to myself. So HottoCare, we are a group that is 100% focused on delivering the Medicare Guide Program, Dementia Guide Program. What that is this incredible benefit that Medicare now provides for individuals to get wraparound dementia support, 100% covered through Medicare. And so we'll obviously talk more about what that includes. And so our team has, over this past year specifically, there's a lot of infrastructure and a lot of programmatic pieces to stand up. So our team 100% has been focused on building that this past year. And so a little bit about myself. So my background is as a physician, an internal medicine physician. For about 20 years, I have really largely worked with older aging adults. And in particular, I worked very closely with individuals who, in my prior practice and with Sutter Healthcare, and then previous to that, Stanford, we were focused on building a primary care model. And one of the things that I saw in our wraparound model that our champions for the program were really for family caregivers who were caring for individuals who were functionally homebound. And so as you can imagine, many of them had dementia. So I really understood and saw the need that we needed a very special kind of high touch wraparound model for these individuals, but also one that focused very much on incorporating the family caregiver into the model. So Medicare saw that need too, and that's how the Dementia Guide Program. And so I transitioned into 100% focusing, building, a model, a program for that.
Right. That's amazing, especially the fact that Medicare recognized the benefit of this. So what is the impact on the family caregivers when they're taking care of a loved one with dementia, Alzheimer's? There's multiple different types of dementia, but that not only you as a physician, but also Medicare as a government payer bureaucracy also saw the benefit of that.
Yeah.
Maybe you can share a little bit of like what the impact is on them and maybe the high level benefit for them.
Yeah, absolutely. I see what you're getting at. So number one, ultimately Medicare is covering this because there's been 30 years of research. This has actually been studied that if you supporting the family caregiver, supporting a caregiver is the best way to support the person living with dementia. Right. So there's lots of information and research evidence that supports that. And more importantly, when you do that, what you end up doing is delaying the time. You're able to enable that person living with dementia to remain at home longer, which means that you delay the time to nursing home care. And it's significant. And what that means for the government is that they're spending less in supporting that nursing home care because that's oftentimes paid through Medicaid. And so this is ultimately, it's evidence-based. This is ultimately why Medicare said, hey, this is a no-brainer. We need to build a program for family caregivers. We know across the entire ecosystem that family caregiver support is fragmented and doesn't currently, essentially the models that support a family caregiver are essentially non-existent for those with dementia. So this is
Right.
Medicare's attempt to have a funding model
Yeah.
that then enables this to spread not from a few pockets and within academic places, but across the community.
Right. And I think the other kind of adjacent downside of not having support is that the actual caregivers suffer from health issues. And I've noticed, with my own clients in our home care company, but as well as, research with Alzheimer's Association, that I think it's like 40 to 60% have a medical episode or even, die
Mhm.
before the person they're taking care of because of the stress. So this is just, I think, across the board so important. And I'm so
Yeah,
glad that you've kind of spearheaded this and shifted
sure.
from your practice to
Mhm.
entrepreneur and founder, and that's amazing. What is so? Can you talk about a little bit? So, who exactly qualifies for guide in this program? So, this isn't just for
Mhm.
everything. This is specifically for dementia patients and
Mhm.
their caregivers.
Yeah, great question. Well, eligibility. So if the person living with dementia has traditional Medicare,
Uh-huh.
they can have a supplemental plan, they can have Medi-Cal, they're eligible for the program. If they have Medicare Advantage, we oftentimes get
Uh-huh.
this question, then they're not eligible for a growth program. However, it is actually, if they so just choose, they can actually readily switch into traditional Medicare to get
Okay.
access to this program. So in our geography, it's about 50% that have
Uh-huh.
Medicare Advantage versus Medicare.
Right.
Now, the second piece is that they need to be living residentially. So at home
Uh-huh.
all the way through memory unit. If they're in a
Okay.
nursing home, then that's duplication of services. They have 24/7 nursing home care, so they're
Sure.
not eligible. If they're on hospice services, they're not eligible. If they're part of a PACE program, a PACE program are for
Uh-huh.
individuals where their primary caregiver belongs to a PACE program because they have Medicare, Medi-Cal, then they're not
Okay.
eligible. But again, I do want to stress because this question comes up often. If they have Medicare and Medi-Cal, they are eligible for our program
Okay.
as long as it's not part of PACE.
Got
And
it.
then the other thing I want to highlight is we get this question often, which is they do not have to have a diagnosis of dementia. It is actually
Oh.
very common, and I saw this a lot as I was working with practices around the large health systems I've worked with,
Mhm.
that individuals do not have that diagnosis of dementia. So the family caregiver may be very well aware or suspect that, and
Uh-huh.
so we're able to make the diagnosis of dementia. So if there's just any suspicion of cognitive impairment, they can
Right.
also apply for the program.
Okay. That's great. So that's kind of getting over a pretty big hurdle, which people say,
Yeah,
"Oh, there's not a diagnosis. I got to go to see my doctor again," and all these things.
nope,
This is you
they do
just go
not.
straight through you. You can assist them on that,
Correct.
um,
That's our
diagnosis.
bread and
That's
butter.
great. Okay. Oh, that's fantastic.
Yeah.
So that's a great next shift. So what are the different components of the guide program? So we'll get to
Mm,
how they enroll later, but so they're in the guide program.
yeah.
You've helped them get authorized and all
Yeah.
of that. So
Right.
what happens next? So what are the
Yeah.
services they can start to tap into?
Yeah, great. So, gosh, there's so many services, which is why it's a full-time job getting everything set up. But Medicare was spot on in terms of the needs and centralizing all the needs in one place. So it includes
Mhm.
ultimately what I will say is it's largely driven by what the family caregivers are looking
Mhm.
for, but what they
Mhm.
have access to is a comprehensive care plan,
Mhm.
and generating that, which is then shared with their existing care team. So again, they
Mhm.
keep their primary care team, or if they have other specialists, neurologists. So we're responsible for communicating those care needs to them. It includes close attention to their medications or medication management. Oftentimes, there are medications that need to be deprescribed, their medication interactions. So again, since we have a clinical care team, taking a close look at those medications, communicating those changes with their primary care provider or other prescriber. It includes respite services. So this is a big piece. So $2,500 is actually more in our geography,
Mhm.
but just to make
Mhm.
it simple, it's the equivalent for in-home care respites, equivalent about
Mhm.
2 to 2.5 weeks, which can be spread out and used however they want throughout the year. Use it or lose it. It renews every year. They
Mhm.
can also use it for a day program. They can also use it for an overnight facility. So that's a huge benefit, is that respite.
Yeah.
So that opportunity for a caregiver to take a break. And then there is what I call peer group support and
Mhm.
education. So we have a couple of partners. We also work with social workers and other dementia experts. They're leading virtual sessions. So we share that on a calendar, and then a family caregiver can join. They can meet with other family caregivers who are experiencing their same the same
Mhm.
journey, to share, to get some education and training. Another resource is frequent check-ins with the care navigator. So the care
Yeah.
navigator is a person on our team who's dementia specialized. They've received 20
Yeah.
hours at least of dementia specific training, but they also have received a lot of training around coaching skill sets, like
Okay.
communication skill sets, being an excellent listener. And so what they do is they check in once a month with the family caregiver,
Mhm.
and it's really driven by the care plan and whatever
Okay.
immediate needs they want addressed. Let's see. I think that those are the high level.
Yeah. And to that point you were just talking about, so that's 24/7. So we know that many times with dementia, it can progress and it can change
Mhm.
overnight sometimes. And from my own experience with our clients, we'll get these calls and, hey, they're doing this now. What do we do? And now to come from a coaching and a medical perspective to help them in the moment that they actually need the help,
Mhm.
that's huge. And I don't want the value of that to be underestimated, because those are the
Mhm.
critical points in
Mhm.
time when they really need help, when they're overwhelmed. Also, I wanted to not let it go by that this is an addition. They don't have
Mhm.
to change their doctor. They don't have to change their health plan or any of those types of things. I mean, unless they're changing from an Advantage plan, there might be some adjustments there. But this is all collaborative with you with their existing medical care team, right? So
Mhm.
this isn't anything they have to make any
Yep.
changes, because that could be
Correct.
perceived as a
Yeah.
hassle or a
Yeah.
barrier. Or so this is,
Absolutely.
I
Yeah.
think, how this has been structured is so wonderful that they're
Mhm.
trying to make it easy instead of
Mhm.
hard to
Mhm.
work with you and to get the care they need as quickly as
Mhm.
possible.
Tom, can I highlight one more
Yeah.
thing? The
Yes.
other the other barrier that Medicare removed is the
Uh,
20% copay, right? So typically for
okay.
Medicare programs,
Yep.
the beneficiary is, responsible for 20% of the bill.
Yes.
Medicare is covering this 100%. They have removed
Yeah.
all barriers. They want wide adoption.
Yep.
So you don't change your primary, they're covering all the expenses, they're giving you
Yep.
$2,500 the rest of it.
Yeah. I think we need to underline that, because that was one of the
Yeah.
other things, because nobody will believe that it is
Oh, really?
included.
Okay. I know
There
we
is
didn't
no
believe it.
copay.
We've asked multiple times as well to Medicare. We're like, wait,
Yeah.
no,
Yeah.
they're really, yes, it's
Yeah.
true.
That's what's so wonderful about this, is because there's so many benefits and it's so unusual of how it's structured. And we were talking earlier about this is a best kept secret right now. We're trying to get the word out. There's so many people that can benefit from this. Tell me a little bit about your team at HottoCare. Oh,
Yeah,
and then also tell me, so what does HottoCare mean?
sure. Sure, absolutely. Yeah. Okay. And then I'll talk about the team. Yeah. So
Yep.
hoto is a Japanese word. I'm half Japanese,
Okay.
and hoto means a sigh of relief. So I think it really sort of embodied what ultimately the experience we're trying to bring, for the family caregiver. And I want to point out that is actually our number one metric. So this is the other thing that I loved
Oh,
about Medicare. They said the most important thing for you to do and what we're measuring
mm,
you on is that
yeah.
you're reducing the stress and improving the quality of life for the family caregiver and the person with dementia. So,
And
um,
just a quick interject there. That is usually the last thing the family caregivers are thinking about, because they're
that's
so
right.
focused on the
Yep,
person. And
that's
on
right.
some of my other guests on here, we've talked about people
Yep,
neglecting themselves.
yep,
And this, don't want to get it wrong, that this program is directly targeted on the family caregivers to prevent the
that's right.
burnout and give them the space to take care of themselves and what they need to
Yeah,
do. So
yeah,
that sigh of relief, that peace of mind,
yeah,
that
yeah.
name is perfect. I see it all the time. So thank you. So yeah, so tell us about your team.
Yeah, very excited about our team. We have a gem of a team. Everyone is there for mission driven reasons. But in terms of the individuals that consist of our team, so there are care assistants who help to
Mhm.
support kind of the onboarding and comprehensive assessment. We have the care navigators that are really the quarterback and the point person for
Mhm.
the families. And then we have physician assistants or nurse
Mhm.
practitioners, and social workers. So we're kind of behind the scenes. We huddle on a regular basis,
Mhm.
right together, which you've joined and you've seen.
Mhm.
This is the chance where we do teaching, we do escalations, we are kind of building the understanding around
Mhm.
dementia and our families. But also, this is the escalation, right? So clinical
Right.
issues can get addressed quickly.
Right.
I forgot to mention we have 24/7 access as well, right? So we've got that clinical team that's
Yeah.
there to address those, overnight, particularly behavioral concerns.
Yes.
Yeah. So that makes up the core care team that families will interact with.
And I know that HottoCare primarily serves the San Francisco Bay Area. Is that correct?
Correct. Yes, we're in 5 counties around the Bay Area. So San Mateo, Santa Clara, Alameda, Contra Costa, San Francisco.
One of the things I like to do with the podcast too is to provide some type of value as well as outside of the Bay Area. And I think this is another huge one. So this is also a national program. So this is something that's rolled out. So and I'm sure there might be nuances on how the enrollment works per the different providers, but if they're not in the Bay Area,
Mhm.
can they just look up guide online with Medicare, or how does that work if they want
Yeah,
to?
great question. We oftentimes get this question. We help to navigate them. There is if you Google it, there is a guide website and there is an
Mhm.
Excel list of the other guide participants. There's about a
Okay.
little over 300 across the
Mhm.
country.
Yeah.
It's a little difficult to tell which geographies, right, which
Okay.
counties they're located in.
Mhm.
But yes, but that is one way that they can do that. One thing I want to stress is that the geography is based on where the person living with dementia is located. So we
Okay.
oftentimes have family, right, that are located in, New York, Florida, Texas,
Yeah.
right? But so
Yeah.
long as the person, right, it's the geography of support
Yeah.
is in the county of the beneficiary.
Right. That's super common. You have the
Yeah.
adult child that's in another state trying to
Hmm.
remotely
Yeah.
coordinate services
Yeah.
and things for their parent. So
Yeah.
coming back to you, so what does the enrollment process look like? So I would imagine people are thinking, oh, this has got to be a big hassle, but it's not really.
Yeah.
It's again that the theme of smooth.
Yeah.
So how do they start the process and what can they expect?
Yes, right. Well, there's a couple of ways that they can come in. If they come, they can
Mhm.
go to our website and
Mhm.
there's enroll, and there's a couple of questions that get them that it takes less than a minute to fill out
Mhm.
the form. So they'll get a call from our care team. They can also go through 76 Dementia. So that's a text message. So that
Okay.
is where then they will get text-based access to our team.
Mhm.
And then from there, they get a live person. That's the care assistant. I forgot to mention that we have care assistants that are Spanish speaking as well. And so they help to just essentially first capture eligibility. So make sure that
Mhm.
you are eligible for Medicare. We'll do real time checking and then take you through some short survey based information
Mhm.
that we need to ultimately submit to Medicare for eligibility. And it's checking, I think, as we talked earlier, right? Making sure
Mhm.
nursing home and hospice and on the
Yeah.
back end, Medicare will check those things. We also have to attest for the dementia. So our care team, whenever possible, rather than having to recapture all that medical information, we don't do that. We actually pull your records. So once
Oh.
yeah. So you sign a consent to say that you're part of the practice.
Mhm.
So therefore, then we can go and we can, look at your records from your primary, your neurologist, wherever it is. And if you don't have a diagnosis of dementia, then we'll, take you through a few steps
Okay.
and ask a few questions that will help to get that diagnosis of dementia. Once we make that attestation, then we send that to Medicare. There's about a 2 to 3 week turnaround time for us to hear back from Medicare, right? And then
Okay.
they'll tell us, okay, yes, you're successfully aligned with the program. And then we can move
Okay.
forward with all those other benefits.
Oh, great. So if the actual patient or caregiver
Hmm.
is on top of it and they're filling out the forms and everything, because everybody's on a different timeline depending on what's going on with their life. But if they go
Yeah.
through and they're signing and filling out all the paperwork and the surveys and everything, it's sounds like it's under 30 days, potentially.
Yes, exactly. Right. If they decided to do all of the survey, if they can do the surveys themselves,
Mhm.
and they just did that in one setting, it would take about 20 minutes.
Okay.
And then from there, there's a little bit of lag time for us to review the records, but
Mhm.
could be pretty quick. And then, right, like I said, then submitting to Medicare. So yes, all of that could very readily happen within 30 days.
Yeah, because usually people, I mean, hopefully people are going to be able to access these benefits kind of ahead of a crisis. But a lot of times they'll find out about this and they need services right now. And that's a pretty
Yes.
quick turnaround compared to some of the other benefits and programs out there that sometimes take a year to get people enrolled and approved and on board. So this is relatively very fast to get that needed
Yeah.
assistance to them.
Yes. And I want to stress that we say you don't have to. So we have a pathway that if they truly have an immediate need, and it's, let's just say it's like a medication change or
Hmm.
something, right? Something
Yeah.
clinical that they need addressed now, then we can address that while we're waiting for Medicare
Okay.
to, yeah,
Wow.
to accept.
That's
So we
fantastic
have a
too.
pathway for that.
So this program sounds amazing. Are there any restrictions, or can they
Mm.
be on this forever,
Mhm.
or is there a limitation on how many benefits they can get from this, or is it just unlimited?
Yeah, great question. Yeah, it's basically unlimited. So right now, Medicare has committed to funding this program for 8 years. So this is kind of a demonstration. It's an 8-year demonstration period. So hopefully we will all do what we are supposed to be doing and they'll continue the model. And so there's no limit, right?
Okay.
You can continue. The average person living with dementia is, roughly around a decade.
Yeah.
And in terms of accessing services, right, there isn't a
Okay.
limit to that.
I think one of the things that I don't know if came across, but the level, even though they're not diagnosed, the level of
Mhm.
dementia needs to
Yeah.
be, I think, moderate to severe.
No,
So it's actually, or so what is it?
no, great
No.
question. Yeah, let me talk about that. So
Yeah.
anyone that meets the criteria for even mild dementia they're eligible for the program.
Okay.
The degree of dementia does determine some pieces of the services. So for
Okay.
example, the in-home, this is minutia, but the in-home assessment, whether that actually happens in the home. And then to be eligible for respite, you do need to have a family caregiver and you need to be at least moderate stage dementia. So that's probably what you heard.
Because this is really truly for the respite piece. If they're very early stage,
That's right.
the respite is probably not as needed at that point.
That's correct.
Is there anything else that we haven't talked about that you'd like to share, either about the guide program or HottoCare?
Yes, right. Well, you know what? So I think I was going to the most common question that we get from family
Mhm.
caregivers is what's my
Yeah.
time commitment? So
Yeah.
we understand, right? They sort of see on the flip side, there's this whole plethora of programs.
Uh-huh.
What I want to stress and what we tell is like they're optional. You don't have to. And
Yeah.
so if there's a requirement, the minimum requirement is actually that touch point with the care navigator. So we say at a
Okay.
minimum, just being willing to have a 5-minute touch point with a care
Okay.
navigator. Of course, we see
Got it.
much more utilization than that.
Right. So you're talking about the time commitment of what do they need to do as part of this program,
Correct.
where
Right.
I see it as the opposite.
All right.
Feel like they're going to take
Yeah.
way more of your time because they're, thirsting for this information and for assistance, as opposed to like thinking it's a
Yeah.
burden that they need to contribute the time.
Those are the
It's the
questions we get
opposite.
from the family caregivers, right? The opposite.
All right. Well, here's one more. Are there any, besides that, are there any other misconceptions, or it's a pretty new program? So maybe there's not, it's just getting
Yeah.
the word out about it. But I don't know if there's anything questions you get, maybe that people perceive besides the fact that they can't believe it's free.
Yeah, no, I would say it's around insurance. We find that
Okay.
most people are not entirely sure about their insurance coverage. Don't worry
Okay.
about that. Or if we're taking
Yeah.
referrals, it's fine. You
Right.
don't need to know what insurance they have. Just if you're suspecting, again, you don't have to
Right.
have dementia. If you're suspecting
Right.
the cognitive impairment, send them our way. The
Yeah.
first thing we'll do is check eligibility so we can
Okay.
do that. So that takes that off, that removes that barrier. The other thing is, and you hinted at this, Tom, which is we do try to trust. I think there's kind of two buckets. There's individuals who are coming to us who have an immediate need, the house is
Mhm.
on fire, and
Right.
those who are sort of things are smooth, steady
Yep.
Eddie. And one of the things we sort of say is like, hey, what is the advantage of like utilizing the services even now when you're like, oh, I see all those
Yeah.
services, I don't really actually know what value that's going to
Right.
bring or how they're going to use that. As most people know, like with dementia, things will progress or decline. You'll have
Yeah.
moments. So have a care team, get plugged in, have that care team that
Yeah.
already knows you, that you're comfortable with.
Yeah.
And I think most people don't realize they're inventing a playbook or
Yeah.
a wheel on how to manage situations. That's our
Right.
role. We're making it
Yeah.
easy. We've already have that playbook in the algorithm, so we can save you having the stress of having to figure it out. Really, that
Yeah.
navigation, right? You come to
Mhm.
us the question, we'll have an answer on some options on how you approach it. So that's the
Yeah.
advantage of getting a care team that kind of knows
Yeah.
you, your preferences,
Yeah.
right ahead of kind of when
Yeah.
the decline happens or acute
Right.
issues happen.
No, that's great. So they can start. ahead of the need, get plugged in, already have everything in place, get to know
That's right.
you. And then when things progress to that next level, they're already ready to go. That's really smart. Well, this is a good kind of segue to the end. So all of the different ways to contact Dr. Taylor's team and HottoCare, we'll have that all in the show notes, the texting, the email, the website, and every way, and then also to answer all your questions. Thank you so much, Dr.
Thank
Taylor,
you,
being on here
Tom.
today. This is
Yes, this has been
amazing.
a pleasure.
Highlight, this is a free program. It is on top of everything that you already have as far as your care team and your primary doctors. This is a best kept secret that we're trying to get the word out on. And please take advantage of it. Please reach out to HottoCare and Dr. Taylor's team.
76 dementia. 76
Yeah.
dementia.
76 dementia. We'll have that all in the notes, so it'll make it really easy for you. All right. Well, thank you so much. And
Thank you,
thanks
Tom.
everybody again for joining us on the Synergy
Thank you,
Sessions.
everyone.
All right. Bye now. Thank you for joining us on the Synergy Sessions. We know you have a lot on your plate, so we really appreciate you spending the time with us today. If you found the information in this episode useful, please reach out to the guest or the resources in the show notes. I know they would appreciate it and would love to help. Also, if you have an idea for a future episode, please reach out to us on Instagram or Facebook or email us and let us know. We'd love to hear from you and provide information that's useful. Lastly, please remember, you don't have to do this alone.